Hey guys, welcome to Meds Made Easy. My name is Tarun Verma with Pharmacy Central. Today we're going to be talking about Subutex and Suboxone. So both of those are used for opioid withdrawal or opioid dependence. So usually you're part of a rehab program, you're trying to get off of opioids or heroin or any kind of like hard narcotic drug type thing like that. So Subutex is buprenorphine. Suboxone is buprenorphine plus naloxone. So we'll kind of group all of that stuff together and talk about it in one video. There's no point in making two videos on it. So the opioid crisis, everyone's kind of heard of it. This is one of the mainstay drugs that you use when you are going through a withdrawal program of heroin, crack, cocaine, painkillers, etc., etc. And so how it works, the buprenorphine part, how that works is it provides the same kind of pain relief that you were getting when you were taking the painkillers or the other hard medications, but it won't give you the high. So let's see here, how can we kind of do it? So the easiest way to kind of do it is that there are opioid receptors in your body, your brain. And so what this drug does is it binds to that and it just gives you the pain relief without the high. Now, the naltrexone part of it is it binds to it and prevents the opioid from, so if you try to take drugs with it, it won't work. Naloxone straight up like, bye girl, and it blocks the painkillers that if you're taking, let's say you're using hydrocodone or something, it prevents that from binding to those receptors and giving off that intention, so that intended relief. And so that's why you kind of see naltrexone used with it. So that like the Suboxone product is a little bit more effective in that respect. It's definitely awesome in the sense that it deters people from misusing it. So I'm kind of getting ahead of myself here, but try to keep up with me a little bit because it's hard to talk about this and not mention something else that I'm going to mention later on right now, but you have to go in sequence. Naltrexone, you put that in these medications to prevent people from injecting it, snorting it, et cetera, et cetera, et cetera. So Subutex has been used and abused before. So when you're coming off of it, you can get addicted to the Suboxone or the Subutex part of it. But by taking the naltrexone that's been added with the Suboxone, it prevents you from feeling that high or whatever, or injecting it. Any product that has naltrexone in it, if you try to inject it, it hurts. I've been told. I haven't used it myself. I haven't tried it, nor should I. But it hurts a lot. I mean, that's all I've been told. So just keep that in mind. If you are someone who's coming off of this stuff and you feel the need to ever try to snort this, inject this, this stuff will seriously hurt. You'll probably end up in the ER. From what I hear, it's like total body pain. And that's why more doctors now, I see them prescribing Suboxone, not Subutex, because there have been instances where people crush up the Subutex and snort it, and it gives you a better high, or can in that respect. Let's see here. If you have renal issues, you're okay. Don't worry about it. This doesn't really need to get tweaked or twerked. Hepatic, if you have any kind of liver issues, you definitely want to make sure that your doctor knows about it so that they tweak your dosages. We can't even talk about dosages because when you're talking about a withdrawal therapy rehab program, your dosages could be anything. Your doctors are carefully monitoring you. You could be on it several times a day. You could be on different dosages. It's just no one way to take it. Just because there's no one way to go about withdrawal. Everyone withdraws differently. Everyone comes off of it differently. Which is why I can't even tell you how long it takes to kick in either one of these products. It is not properly known because everyone's body is different. Now, the one key thing is whether you're taking like Suboxone comes in a film, and then there's another one which I'm forgetting the name of. It's a dissolvable tablet, not a film. It doesn't matter which formulation you use, they're both gonna kick in about the same time. But everyone's body is different, so you can't talk about when. So one person's body may kick in an hour, another person may really feel the effects in about 4 or 5 hours. So it's body specific and also specific to how deep your withdrawal is. That's also important to kind of mention. Let's see here, the half-life, these drugs are in your body for it's a very long time. So normally for a Subutex or Suboxone product, you're looking at anywhere from 24 to 42 hours it takes for half the drug to get out of your body, which means you can extrapolate it takes a lot longer for it to get out of, for the other half to get out of your body. Let's see here. I'm trying to remember everything else that I need to. You need to be careful about any other central nervous system depressants you may be taking. So if you're taking, anti-anxiety medication, depression medications, all of this needs to be very carefully titrated. Now, you're probably not on this drug casually because it is a control medication. So your doctor should know about all the other medications you're taking. It causes respiratory depression because, again, it's mimicking the opioid minus the high, so you can still kind of get the same sort of issues that you were having before. So if you take too much of this stuff, you could die, kind of like with painkillers and things that we've seen, or drugs. It causes respiratory depression. Essentially, your body just shuts down. If you're lactating, should not be on this medication. If you're pregnant, you should not be on this medication. All of this can bleed into the baby and cause what they call neonatal withdrawal syndrome, and that's just terrible stuff. We don't ever want that and hope that for a baby. Again, really this kind of comes down to addiction. And I know how this sounds, but one of the big things that happens, and I've seen in practice, is people will get off of their opioids, they'll get off of the hydrocodones and the morphines, et cetera, only to get addicted to Suboxone. Now, there's two reasons why this happens. Eventually, if you're on this long enough, your body develops like a physiological sort of addiction to the Suboxone because, before it was hugging on to the opioids, now it's hugging on to, it needs something else to hold on to. So, rehab and recovery is always a long process, but people in the process do get addicted to this. Now, this is less dangerous than those medications, but you do develop an addiction to this medication, but then your doctors help you come off of that too. It's easier to get off of this rather than the opioids, so it's kind of like step down. The other thing is addictive personalities. This kind of gets into the entire discussion of addiction as a whole. If you have one of those personalities that's an addicting personality or an addiction personality, doesn't matter what we put you on, you're gonna find a way to get addicted to it. So one of the medications that we use for pain that is a great substitute for hydrocodone is tramadol. Tramadol, everywhere in literature, it is not supposed to cause any kind of addiction potential. It's just not really there. But we're starting to see it out in practice now. People are coming in and doctors are going, yeah, you know what, they've developed a tramadol resistance. They're starting to get a high from it, and now when I take them off of tramadol, they're getting withdrawal symptoms. That's, it's not in the literature, but we see it, right? I've seen it plenty of times in my different practices. So what do you do at that point? It's very hard because, again, addiction is a very complicated disease state to really kind of attack because of that, because you have this sort of psychological, physiological hold that addiction can take. And which makes treatment and rehab that much more difficult. I'm trying to make sure that I've gotten everything. Again, you use this medication to prevent your withdrawal symptoms, and then and reduce your cravings. But you take it in conjunction with other things as well. So again, it's very hard for me to get into details just because everyone's program is always just so different. I'll put up a list of side effects to watch out for here. Other than that, I think that's it, guys, with this one. If you have any more specific questions, leave them down in the comments. I can kind of give you more targeted answers rather than kind of just speak so generally about this. Give us a like. Let us know how we're doing with this page, and are these videos helpful? Are they not? What more do you want to see? If there are some drugs that we haven't covered and you want to see them, let us know. It's just, there's like 500 drugs out there. There's no way we'll be able to cover all of it. So we're kind of, this video is actually somebody's request. So if you have requests, let us know and we'll make the videos. We want to make videos that'll help. We don't want to make videos that no one's going to watch and it doesn't help anyone. So guys, thanks for tuning in. We'll see you next time on Meds Made Easy. Thanks.